Good afternoon. My name is Armando Darias, and today I'm going to be speaking to you about Clostridium difficile, also known as C. diff. What is C. diff? C. diff is an inflammation of the colon caused by the bacteria Clostridium difficile. It can cause severe damage to the colon and even be fatal. It is also classified as a nosocomial infection, which basically means it can only be obtained in a hospital setting. What causes C. diff? C. diff bacteria are found throughout soil, air, water, human and animal feces, and the food products such as processed meats. Spores from the C. diff bacteria are passed in feces and spread to food, surfaces, and objects. When people who are infected don't wash their hands thoroughly, it can spread. If you touch a surface contaminated with the C. diff bacteria and accidentally or unknowingly touch your face or hands, you could also become infected. Signs and symptoms. There's two types of C. diff infection. There's mild and moderate, or there's severe. For the mild and moderate, the signs and symptoms are watery diarrhea 3 or more times a day for 2 or more days, and abdominal cramping or tenderness. For the more severe infection, you have watery diarrhea 10 to 15 times a day, severe abdominal cramping, fever, blood in the stool, as well as dehydration due to all the diarrhea. Complications of C. diff. C. diff can lead to toxic megacolon, perforations of the colon, sepsis, which means just overall infection inside the body, and in some rare cases, even death. Treatment for C. diff. The first step for any C. diff patient would be fluids. Due to the constant diarrhea, the patient can become dehydrated, and the fluids will prevent any type of dehydration. After the patient has their fluids and are properly hydrated, that's where antibiotics come into play. Some of the antibiotics that are used for C. diff are fluoroquinolones, cephalosporins, penicillins, and clindamycin. Prevention. Hand washing is key when coming in and out of any C. diff patient's room. You want to avoid any spreading of the bacteria. Warm water is preferred. Contact precaution. Following proper guidelines when entering and exiting a C. diff patient's room is key. Proper attire is necessary, which means a contact gown, which is a gown that covers the whole body, a mask, because you could catch it's also in the air, as well as gloves. And aftercare cleaning of the room. After the C. diff patient is discharged, proper cleaning of the room is key to prevent the next patient from obtaining the disease. When it comes to the cleaning of the room, it's not just any type of cleaning. There's a machine that uses ultraviolet rays to eliminate any lingering bacteria in the room. Demographics. C. diff infection is estimated to affect about 140 people for every 1,000 individuals. In the U.S., the majority of cases are associated with in a healthcare setting, nosocomial infection, and it is more common in the elderly, 65 years old or more. These are my references, and that concludes my presentation on C. diff. Thank you.